and welcome to this BNEWS Weekly Special Report. I'm your host, Rich Hosford. I am joined today by Board of Health Chairman Dr. Ed Weiner and Vice Chairman David McSweeney, and we are talking about their proposal for an Associate Health Director. Thank you, gentlemen, for joining me today.
Thank you.
Thanks for having us.
So I wanted to start off sort of big picture. Dr. Weiner, can you talk just in general about, sort of all the work done by the Board of Health and, the health department, both, during the pandemic, but even before?
The Burlington Board of Health touches every member of this community every day. When it comes to public health, the Board of Health, and specifically our major responsibility, it's about time that the town of Burlington and its leadership got serious about our impact on health, the welfare, and the economic future of this town. We're in a new world and a new paradigm, one where things will change and must change. And we have to ensure that this change is both appropriate and safe. Safe for everyone, our families, kids, seniors, and those who work and those who visit Burlington. We're involved in public health, nursing, environmental engineering, emergency planning, and its response. We sponsor the 250-person now Medical Reserve Corps of Burlington. We're involved in all aspects of the development and redevelopment of this town, now biotechnology. And to put all that into one single spot, it's now covered with one word: pandemic. We have many, many police. We've got many fire, an ambulance, the DPW, water department, all outstanding groups. But there are many, many individuals who make up those departments. We do all that we have to do and mandated for what we have to do with a 5-member elected board and 5 professionals. It's clear that as we move forward into the 21st century, as we move forward for biotech and keep things going within the town with our COVID-19 pandemic, you need a larger, more professional, somebody involved in biotech to ensure the future of this community.
Now, I know one of the things that you've been talking a lot about, when we've been just chatting, is just the number of hours that members of the board of, the health department, Board of Health have been putting in, especially since the start of the pandemic. Can you just sort of talk about kind of the workload that people are facing?
David, why don't you take that?
Yeah, sure. So, Susan Luminella, who is the director of public health, in all her staff. So we have staff that's dedicated to, we have a health agent that's dedicated to the health and safety and the inspections for the restaurants, tobacco distribution, the swimming pools. We have an associate director, associate health agent that assists in those, because as the community is growing, so are the restaurants and all those other facilities that I just mentioned. So she has the staff underneath her that their primary focus for the past year, even though they're hired, and we have a nurse, a supervisory nurse, an environmental engineer, even though they're carved out and focused on those other areas of expertise, they have literally been working nonstop as it relates to COVID. So we've had to not only reshift and readjust the staff. Susan's been working 7 days a week, 8, 10, 12 hours a day. She worked, New Year's Eve, New Year's Day with escalations and issues. So, we've really had to refocus the staff to handle the pandemic And that's not just Susan, it's the entire organization. In addition to that, we still have day-to-day stuff that they focus on. So we still need our restaurants inspected, our pools inspected, the community pools. We still need to ensure that tobacco distribution is done appropriately by law and regulations. We still need to have flu vaccines done, in household hazardous waste. We still need make sure that the contamination in town that's been ongoing for 50 plus years, and trying to rectify that we're still doing that on a day-to-day basis. So not only are we impacted by COVID, we're working tirelessly to make sure things don't fall between the cracks. And I say this a lot, and I've said this to a couple of folks I've talked to last week, and this is no disrespect to the other very impactful departments in boards in town. If things start to fall between the cracks in those things, there might be a delay, and maybe in a subdivision or whatever the case may be. When things start to fall between the cracks at the Board of Health, there's public safety. Where do we let things fall between the cracks? We don't want restaurants inspected. We don't want pools inspected. Like things like that. That impacts the health and safety of our community.
No, that's definitely a good point. We don't want anything falling through the cracks in terms of public health, and I think that this year has shown that more than any other. David, staying with you, I know you were part of the subcommittee about this position. So sort of talk about the process of, how you kind of came to the determination that this position was something that would be beneficial to the department.
Yeah, sure. Ed, certainly did a great job in touching upon some of that. Literally, when I look at Susan's eyes, right, and she's working 7 days a week nonstop and handling, calls from everybody in the community. Don't forget, she's handling calls when we had Little League start back up or youth hockey start back up. Those parents are concerned, obviously, and they're calling all the time. So there is COVID-related, certainly, escalations that were happening that we need to address. And as the governor changes regulations and policies, that sits on the shoulders of the Board of Health. But we went through it. It's not like Ed and I just one day came up and said, geez, at a whim, we need more staff, because we're both business people, and we understand the impact to budget, in making sure that we're accountable to managing to that budget. So it's not like we just sat there. But also Ed as a volunteer, and we're lucky to have him as chairman of the board, but he's been working 7 days a week as well on this, and it's not fair to him to be doing that. So we had a subcommittee formed through a board meeting, right? So we had the Board of Health meeting during a regular meeting. It came up as an item. We had a unanimous vote by the Board of Health to continue discussing it through and researching it through a subcommittee. A subcommittee was formed, and through that subcommittee, with the addition of some staff at the Board of Health, we went through and looked at the time and tasks that every staff member within the Board of Health is currently doing, the amount of time they put on it. And that's even without COVID. And then we put all the responsibilities on COVID on top of that. It would be a disservice. What the subcommittee came out with is that it would be a disservice to this community if we didn't add staff just to support normal day-to-day operations, in addition to what the new norm is for COVID. And we all know that there is going to be a new norm. The subcommittee brought that discussion point back to the Board of Health. And again, a vote was entered, and it was a unanimous vote that we should proceed through the town meeting avenue of getting the funding allocated for this new position. We also met with the Ways and Means subcommittee. They unanimously voted to support this as well. So this is not a haphazard approach. We did spend a lot of time. Ed and I don't necessarily want to stand up and ask for more money and more people, but we would be doing a disservice to the community if we don't raise the concern that we have.
Okay. And Dr. Weiner, can you just sort of kind of talk a little bit through, what the day-to-day responsibilities of this new position would be, and also how that would help change, Health Director Susan Luminello, help her refocus on sort of bigger picture, tasks?
Yeah, that's when we sat down and we looked with what our director is doing. And it's most important that she focuses on both leadership and management within this community. And she's really got to focus on the leadership. She takes on so much because she has to. I just want to do a comparison whether the departments, they have multiple leadership positions and we only have one. And it's just not fair, especially we're being asked to do more and more. The emergency planning alone and with the Medical Reserve Corps is a huge job unto itself. We're faced with so many diverse things. For instance, if you happen to see what we're doing right now in bringing biotech to this community, and we all know that Burlington is changing. We are a community of office space, and it's going to hopefully become a community of biotech. We're just going to evolve. And with that, we need some specific and very focused expertise, not only in biotech, but also to take some pressure off of our director, who sits in meetings with the police chief and fire chiefs and director of the Department of Water and the DPW. She needs to be at all of those because she is a part of the leadership of this community. And every time we turn around, our governor, our Massachusetts Department of Public Health, they say, you are responsible for this. I keep asking a question, just as an example. Who enforces all of the new public health directives? Well, it's not the police. The Police Chiefs Association said, we've got more important things to do, and I agree with them. And it's not any of the other groups. It's not the fire department. Enforcement is the Board of Health, and that's something new. The other things we do, we're so involved. For instance, our one nurse is involved in so many things, which include the day-to-day communicable disease surveillance. Now you say, now what's that? But we have Campylobacter and hepatitis and pertussis and salmonella and Lyme disease and yes, tuberculosis that we have to monitor and we have to coordinate therapy. It's a lot that we do that is very invisible, let alone all of the development and redevelopment in this community. I think every time I tell someone that the Subdivision Control Act notes that the Board of Health under Independence versus the town of Barnstable, we have all of that responsibility to look at those subdivisions and make decisions, not the planning board, not the selectmen. It's the Board of Health which has to do its diligence. So I hope that gives you a little picture of what we're being faced with.
Yeah, well, I definitely understand, that the Board of Health in the Health Department is very busy. But just a little bit more specifically on, this position, what would be sort of the day-to-day activities of this Associate Health Director?
I think it's going to be managing department so our director can do the leadership things she does.
Okay.
It will be the person who will lead and who will direct all the biotechnology recruitment for this town, as well as all of the work that goes around having biotech within Burlington. Last night in the Board of Health, we had a company come before this which will house on Blanchard Road, will house 20 separate biotech companies. They're all small companies, but they could grow very quickly. On top of that, we've got 12, 14 other companies. Each one has to be inspected. Each one has to be reviewed. Each one has a committee in which somebody within the Board of Health must sit on to review what they're doing every year. And when they're changing their focus, to be there and look at what those changes are. So that person will be managerial, that person will fill in where necessary, and that person will handle all of the necessary biotechnology science which we need in this community.
Excellent. And David, is there an estimated sort of salary range that is expected for this position? And what would you say to people who are concerned about the budget because of lack of local taxes, in order to justify the expense?
Yeah, sure. Thanks, Rich. So we did a lot of research on this type of role, external to Burlington, and also working with human resources with the town and trying to identify what the right role is. And as Ed explained, we are looking for a managerial role and somebody, quite frankly, that has both public health background and that can handle biotechnology, because it's not a concern. It's a type of businesses that we want to come into the community. And as Ed mentioned, we have quite a few today, and there's a proposal in front of us where a company's coming in and bringing in 20 additional biotechnology companies within that role. So somebody that has a diverse background in public health, but also understands biotechnology and kind of managing inventory around chemical and bio material is quite a diverse background, right? And it's hard to find. And we in the Warren article, we're asking for $80,000 annually, which is about where we think this role fits. And we think we can get a good quality candidate at that price range. Just understanding some of the research that we did outside of that. I would think that if somebody, and I totally get it, and I think I said this earlier too, right? Ed and I don't haphazardly just step up here and say we need additional funds for additional role, without actually, thinking it through and talking about it. And I'm sure that there are going to be town meeting members that have concern about what it does to the budget, even every dollar, right? And they should. That's their function in the community. I think I would say, and the flip side of that is, what is it going to cost the town if we don't do this? And if things start falling between the cracks, as I mentioned earlier, we're putting the health and safety of the community at risk for $80,000 a year, and I think that's a tough argument to push against that. So I would say that, and look, if it gets turned down at town meeting, certainly I'll be disappointed. But I think Ed and I are doing our responsibility, saying, hey, we have an issue here that needs to get fixed as it relates to staffing. And we're asking you folks to do your job and to approve that role as well. And I get the budgetary constraints and what it does to the potential tax rate, but the cost of not doing it far exceeds the $80,000 a year, in my opinion.
Yeah, absolutely. And obviously, as you guys this week are starting vaccinations of our first responders. We're going to have more general vaccinations, in the months ahead. Talk about how this position will help with, combating the pandemic and kind of help with the rollout of these various vaccines that we're seeing. And that can be to either one.
I'll take that.
Okay.
Yesterday, we had our first clinic. We vaccinated 50 individuals, first responders. We needed all 5 of our staff members there. We needed members of the Medical Reserve Corps. We have 200 doses that we have to give over this week and next week. It's very labor intensive. Everything's electronic. To have another person there would help with the flow. But more than that, would help with the other duties that we got to do, to manage the dozens of phone calls that we received one floor above where we were giving the vaccinations. Now, we don't know where this COVID pandemic is going to take us. We have no idea if we're going to have to do this all over again next year. We're not sure if there's another pandemic in the wings. Who knows? But we do know that we have all this other work that is barely getting done because it keeps increasing and increasing. We do know that the town is changing and we're going to have to go places that we never thought where we would be going. So to that end, an extra professional will not only help out for the future, but also do a lot of management and community reaching that needs to be done right now. We are doing what we can, and we're doing the best we can. And if you watched last night at our Board of Health meeting, the just amount of complaints which come in, and not only for just the pandemic. We had major issues New Year's Eve that we had to take care of. It had nothing to do with COVID. It just continues. And there are more people, there are more professionals in the police and fire department that were on duty New Year's Eve. We only had a couple, but we had to handle a lot. So we're just saying that this is not your grandfather's Board of Health.
Mm-hmm. And I just got two more questions. This one, I'll go to David. So I think people might understand and say, okay, there's a pandemic, there's vaccines coming out. We understand that the Board of Health might need help now. What's the case for after, the pandemic is over, if, that ever happens, that this position will still be required?
Yeah, it's a great question, Rich. And Ed and I get asked that, every time we talk about adding this position. And if we truly believed that after the pandemic, this role wasn't going to be needed, we wouldn't be sitting here today talking with you. Mm-hmm. We certainly wouldn't be going in front of town meeting to request that role. The stress on the Board of Health staff was increasing even prior to the pandemic. And as we change in the town change that is ongoing, is causing more and more stress to the functions that are happening within the Board of Health. So, we have the district that was added over the last several years, Third Ave that was added over the last several years. We're seeing an influx of biotechnology come into town, as well as, we thought probably at one point in time in Burlington that subdivisions were going to cease, but now we're seeing redevelopment of older subdivisions, right, which is increasing, and the building is not stopping. The buildup in the community is not stopping at all. So we're not here asking for this role because of COVID. Certainly, that's added an additional strain onto the department and into the functions, and that's where the 7 days a week come in, and 10, 12 hours a day. But it was increasingly getting less and less successful to manage day-to-day tasks prior to COVID. And then, as you mentioned, and we don't know what the new norm is going to be with COVID. There is going to be a new norm. Things are changing. It's not going to go away 100% fully. We still have, people feel like the vaccine is here, that it's going to end. And it may be true for some of the people, but for boards of health across the communities, it's actually a new beginning for us, because we still have to do contact tracing. We still have to do tracking by law, by the state. We still have to, and we don't know what the new norm is going to be. We still have new rules and regulations that we have to enforce within restaurants and retail stores. And as Ed mentioned, that's on our shoulders to enforce. Plus, we don't know what the virus is, right? There's new strains that are coming out now. Does that mean that the existing vaccine is going to cure those new strains. We don't know that yet. We don't know if this is going to be like the flu where we need to be vaccinated annually. We don't know that yet. So there is a new norm. And I would say that if 100% 2 years from now COVID goes away, we're still going to need this role for sure. And this was before me being on the board, but we had, we did have a couple of nurses in the Board of Health, and we decided years ago that we didn't need the second nurse, and we were being fiscally conscious, and we did give up that position. So we're not saying that this is indefinite, but it's going to be as indefinite as we know the tasks outside of COVID are causing this position to be created, and the new norm of COVID is just putting it over the top.
All right. And so the way I want to end, obviously this is going to be before town meeting in a couple weeks. I just wanted to, give you both an opportunity, just, a final case that you would, make to any town meeting members that are watching this. And I'll start with you, Dr. Weiner.
I'll end with what I started with, and that is the Burlington Board of Health touches every member of this community every day. And it's our job to keep this community safe. And we need to do that. We need to do that in the face to a changing environment, to changing Burlington. We've talked a lot about biotech today, but every scientific company, and we've got a number of them in this community, we inspect every year. It's not just the inspection, but it's also the ability to continue as a platinum community where companies can look at this town and say, we're a good place to be. And those companies which will replace our aging office space are clean, they're professional, and they're taxpayers. So not only do we have to protect the public, we have to ensure that Burlington is a good place to be for lots of industries that need to be here, because we just can't continue with the paradigm that we're in right now. So we are the moat. We are the area that will protect this community and keep this community viable.
And David, anything?
And I believe that.
Sorry to cut you off there. Anything to add, Dave?
Yeah, and without sounding redundant, I would just say that we are here raising a concern. As Ed mentioned, we're doing our jobs as elected officials in the town to say that there is a problem that we need to fix. And this was pre-COVID, that it was increasingly tough to manage those tasks. And with COVID, it's an impossibility. And I would just say that, again, what is the cost of not filling this role? What is the town going to do because we can't keep up? And that's pretty much, the crux of this thing. We're doing our jobs, raising the concern. Hopefully town meeting will do their jobs and vote in favor of it.
All right, very good. I believe you both make a compelling case, and I really appreciate you taking some time to come and, talk to our audience, our viewers, about why you believe this position is so important, and, good luck at town meeting.
Thanks.
Thanks, Rich. Appreciate it.
All right, we'll talk to you soon.